Hello, everyone. Good afternoon, and welcome back to another interesting episode of Tea Talks Tuesday. So, we are here today as we have recently celebrated the World Cancer Day. So, the theme of this year's is, the fill the gap, care. I'm sorry. Care gap. So we have nutritionist Vasudha Mathur. Ma'am is here to discuss more about the cancer awareness and how to fill this gap. So before we go into the session, I would request Dr. Janaki ma'am to invite Vasudha ma'am onto the Tea Talks. Over to you, doctor.
So welcome, Vasudha. It's very nice to have you on Tea Talks Tuesday today, and being I think you are the one of the most senior most and very much associated with cancer patients for quite long, and still you are doing. And I think no other better person can be to talk about cancer and your experiences with the patients, because what actually adds to anything is the experiences of the doctors or the experiences of the treating team will definitely help and add value to our community, especially dietitian nutritionist community. So I welcome Vasudha Mathur, and I just give a brief introduction about Vasudha here. I know her as a friend for quite long, I think more than 10 years or 15 years or so. And she has done her PG diploma in nutrition and dietetics from SPMVV Tirupati. And she did a PG diploma in preventive and promotive healthcare Apollo Hospitals, Educational and Research Foundation, Hyderabad. And her current designation and workplace is right now she is a HOD and a consultant clinical nutritionist at the cancer clinics. And before that, she has overall 25 years of experience, of course, as a nutrition expert in cancer. Before that, from 1996 to 2005, she worked in Apollo hospitals in Hyderabad as well as in Bangalore. And from 2006 to 2007, she worked in Apollo Clinics, Mumbai. So that's different, totally different places altogether. And from 2007 to a short stint, I think maybe February 2007 to March 2007, she worked with the Godrej Memorial Hospital, Mumbai. And in June 2007 to January 2008, she worked with the NM Medical Center, Mumbai. So she worked in different places in Mumbai at the same time almost. And from 2009 May to September 2010, she worked in Synergenetics Medical Institute, Hyderabad. So after that, 2010 to 2021, that is almost past year, she was with Basavatarakam Indo-American Cancer Hospital and Research Institute, Hyderabad. It's almost 1 decade, more than 1 decade, that's 11 years. So since April 2021 to present, she's working as HOD and consultant in cancer clinics. That is a Cipher, or is it spelled as Cipher? Cipher Oncology Private, Cipher Oncology Private Limited. So she has, to her credit, a lot of awards she received, and she's very active in many activities, and she has done publications as well. The most recent one is being the Sadhana Award at 2020 for clinical nutrition practice. Then she, of course, she's a registered dietitian. She organized many education programs for various groups and organized and hosted first walkathon 2016 on occasion of National Nutrition Week celebrations in collaboration with the Data, that is my clinic. So we really had very good presence in 2016. Doctors, nurses, and various other hospitals also joined the walk, and it was a grand success. We started from Basavatarakam and took a round around the KBR Park and ended at Basavatarakam again. And we also had diet display and one-on-one kind of interaction with the doctors and the dietitians and nutritionists along with the normal general population. General population actually joined in our walk. That I really remember it, and it was a very fantastic one. And I would like to repeat it again with your help. Maybe again in the National Nutrition Week, probably we may go back to Basotarakam or however you say, Vasudha. So she received appreciation certificates from Basavatarkam Indo-American Cancer Hospital. I don't think it's a big thing because she has done so much of work. Definitely she will receive. So and actually this certificate is for conducting internal audit as part of NABH. Then she's a resource person and faculty for SV University Tirupati. Probably she's ex student, right, from Tirupati, basically. Then she's a guest speaker for many institutions and corporate schools, hospitals, sports centers, RBI, etc. She was chief guest at different places for different occasions. She was a guest speaker for the International Cancer Prevention Conference organized by Arogya, May 2018. Attended and participated in different national and international conferences. She was a host and organized many nutrition programs and exhibitions and celebrated National Nutrition Month every year by conducting various activities. She is a certified food safety supervisor by FSSAI and FOSTAC in 2019. She initiated nutrition support group program at Basavatarakam Hospital, which was inaugurated in 2014 by Dr. Sasikaran. And successfully, this program was conducted weekly for cancer patients undergoing treatment. This is really something which will be of great help to people who are undergoing cancer treatment. So she coordinated the clinical case study presentation in Twin Cities for dietitians. She trained postgraduates and graduate students coming for their dietary internships as part of their curriculum. And a few more highlights and achievements are implementing all the practice protocols and leading the team at cancer clinics and managing all the pan-India centers, streamlined clinical nutrition protocols in ICUs in the hospital and have set up the entire food service system at Basavatarkam Indo-American Care Hospital and initiated patient education program which was successfully running and was appreciated well. The same program is underway at cancer clinics also. OPD has been improved and patients are coming for their follow-up and consultations because of good outcome. 25 years of vast experience and expertise as a mentor, good interpersonal and communication skills and work with patients has really led her to this level now. And she has excellent leadership qualities that goes without saying, and she's a great counselor. I had that experience for one of my own client. Then she's a good administrator, of course, with managing skills, and she is always ready to learn new things, always and open to learn new things. So welcome, Vasudha. We are looking forward to learn from you now today with your experiences.
Thank you so much. Yeah.
So the first question is, now you had 25 years of experience. So in this journey of you with the cancer patients, talking with the cancer patients, first let us know how was your journey. Like, as soon as you listen to the word cancer, the sadness seeps in. So how was your journey with the patients? This 25 years of your journey.
Yeah. Yeah. First of all, thanks. Thank you so much, Janaki and Mayuri, and best wishes to Tea Talks, as seen the success over the episodes. And thanks for giving me this opportunity. Oncology, cancer nutrition, we all learn. But the topic that is just a discussion of my experience, I guess, will definitely throw some light to especially the budding nutritionists who all are viewing this. Yeah. My career began at Apollo Hospital. And I will definitely say that everything was going smooth. Childhood, I have had seen my own family members. That time we didn't know as what is happening, and they would grow wheat grass at home and give the wheat grass juice. So this has been, it's been there since long time. So, but after joining Apollo, it was very unfortunate that one of my very close friends' dad was diagnosed with cancer. That was esophagus cancer. And that time we didn't know anything. I mean, I have learned every day of my experience, each and every single day it has been a learning for me. And still till now, if you say that I'm still learning, I don't know. If you say I don't know anything. So that time we didn't know, because it was esophagus. He got operated at Apollo itself, and then subsequently chemotherapy was given. So many side effects. He started losing weight. He was sick, and we didn't know, as being nutrition, that was the starting of a career, and we didn't know as what to do. So days and years passed on, and one fine day, there was Dr. Arundhati Chakrabarti. She was radiation oncologist at Apollo. She called us and survivors, cancer survivors, and we formed a group, and we started a cancer rehab in a very small room. So we would just discuss, and then we would go to the Palliative Care Society, which is in Nampalli. Once a month, she used to take us there. So my interest started developing from there. After which, again, they started inviting us to attend the tumor board meetings. That was again interesting, followed by attending head and neck clinic, which was run by Dr. Umakant Nayak then. So that's how I think I should do something, seeing the patients' agony and their struggle, and we didn't know anything. So started studying and learning about the role of nutrition in oncology, and we didn't have resources, and but still we would gather all the patients, and we would have this multidisciplinary meetings. So this was again tied up with the Wellness RX, which was led by Professor Adrian Kennedy. So I should be really very thankful to that, and I'm blessed that I worked with a team where we used to have a psychology session, yoga session, meditation session. Every Friday we had marked that day for as a cancer rehab. I think it is very important to meet patients one-to-one and in group, because they interact with each other and they get confidence. So and how the rehab has helped them. So that's how my journey began, and after which I got a break because I worked in different areas. And when we moved back to Hyderabad, I got this opportunity to go to, and I took my entry into the temple. I should say Basavatarakam is a temple for me.
Temple. Wow.
Yeah, and I have learned a lot there. And the same thing, I continued there and started a patient support group program. And hundreds of patients would come with their attenders and caregivers, and we would just educate them. There is a lot of stigma amongst patients. So we would discuss about the diet, side effects, what are the side effects, and how they can overcome that. So that has been my journey so far, and I'm looking forward to serve the cancer patients more by educating and giving them some kind of awareness. Yeah,
great. That was
Awesome.
the beginning, and it started fantastic.
Yeah.
Awesome. So ma'am, like in your journey, like I mean, looking at your journey, looking at the entire thing that you have shared, you would have had mixed, I mean, many experiences. So one best experience that you had with with a client, or with multiple clients, or whatever the best that.
Yeah. There are many patients who come for counseling, but there are few patients with whom we develop a good rapport, and they look at us as friends, or who a person or a nutritionist. It's not only me, but it always I have worked in with my colleagues, my team. So what I think is they look out for a year, so that they can talk to someone. So I've had many best experiences in my career. At the moment, I am treating one patient who was referred by one of the doctors, one of the surgical oncologists, and the patient again was esophagus case, and whose total esophagectomy was done. So, and his just part of there was some infection. So there was again one stoma, some kind of a thing which was kept here for the saliva to get accumulated, and the patient was on FJ feeds. So totally nutritionally, totally malnourished patient, full pedal edema, and most of the patients, they have side effects. The treatment is done, but they can't overcome with the side effects. So there were a lot of issues, and being upper GI cancer, there is a risk of malnutrition anyways. So patient was on FJ feeding and lost more than 10 to 15 kgs over in a month's time. Because feeding, again, infection, 2 surgeries. So we put the plan on, and after 4 days, again, we called, and then patient started tolerating the feeds. So over a month, almost 1.5 months, we saw the edema which started coming down. It actually disappeared.
Great.
Wow.
So that could be because of the infection which was resolving, or maybe the proper nutrition together. I will not say that it was just because of nutrition, definitely. No, because even part of infection got resolved, but patient became active. But still they continued taking the consultation, and then, they have taken almost about 3 or 4 consultations so far. They like to talk. And now what I want to highlight is, follow-up is one thing, which it is oncology counseling. It is not for the one time, because every time, whenever a patient takes treatment, the side effects will vary. There are good graphs, there are bad graphs. So you counsel a patient, give a diet plan, and forget it. That doesn't happen. You have to follow up the patient throughout the treatment journey, till the end of the journey. So they are still in touch. That is one patient. And I recall one of my old patient who was scared to take radiation. It was head and neck case. He came, and then we told about the side effects, but we are there from the beginning. If you take care, you will this thing. So the patient everything was done. The treatment planning was done. And a patient was standing there outside the radiation area, and coincidence was that I went there to see a patient, and I saw him. So I said, how are you doing? I think you're done with almost a week's radiation. So I said, no, madam, I have not started yet. I said, what are you waiting for? No, I feel claustrophobic. They took me inside, but I couldn't breathe, and I just came out.
Okay.
So I said, see, whatever it is just a 3 seconds process. They'll tell you waiting is more, but the process is only 3-4 seconds. So you chant whichever God you believe, just chant that God's name. And by the time you finish 21 times, you chant, and you'll be out of it. So after a week, he came back to us and said that, that trick worked, and I did it. So we have to become like a counselor to them.
Right.
And after 10 days, the side effects start. So again, he came, he said, see, you told me, now I'm in trouble. But I know that you already told that the side effects will begin after 10 days. And he was fine. He had lots of issues eating, and we helped them. So in head and neck cancers, there is a lot of swallowing difficulty. He refused to put in a tube. We also encouraged, no problem. follow-up is important. Most important is whether the patient is following or no.
Right.
So if follow-up, and if the patient is following up and adhering to the diet, only then there will be an outcome. So he had a lot of issues with mucositis. So we helped him giving options, throwing options. See, actually, the most difficult part is the requirement will be very high,
Right.
but patient can't take food.
Right.
They can't eat food. So we have to be a little generous and relaxed. And when there are good days, we should just throw meal options and, give them whatever they want to eat, so that, something they eat, and some amount of calories will go in. There was another patient who underwent bone marrow transplant. So there were a lot of issues, and it was his own sibling was the donor.
Okay.
And he did well. There were too many side effects, but he came out of it. But after 6 months, he developed secondary cancer. So he had carcinoma of esophagus.
Oh.
So young boy, maybe he was in his late 20s or early 30s.
Okay.
And he was all depressed, and he took advice, he went away. Then again, he got admitted for this radiation and chemotherapy. And so then he first 2 sittings, he didn't adhere. Maybe he was depressed. So then after which, when we we spoke to him, and then we found out that he's alone and he can't manage eating food, and he was not able, there was dysphagia, so he was not able to swallow. So we helped them with our caterer, and we put him on to our caterers on subsidized rates, and the caterer, they helped him. So he was, wherever he used to take a parcel, and we helped him with the supplements also. So that way he got some confidence. He started gaining weight. And then because of the treatment, his dysphagia started resolving. He got better, and then he got the surgery done. And post-surgery also, we have followed him, and yes, he's doing fine now.
Great.
So the day I left Indo-American, coincidentally, he came to see me, and he was so happy that his surgery went well, and but he felt sad that I was leaving that place. Yeah.
So you may be leaving the place, but you'll be available anyway.
Yes. So that there are many, and starting the day one of my first day in Indo-American, I visited a pediatric case, and patient was in pain, and she had high fever. I counseled, we sent food, we counseled on diet, what she should take, and then next day I went, and then patient was no more. So that was my first day. So it was very depressing. I used to think, my God, how am I going to take it? But over the period, I think it's nothing. I mean, I've seen many good cases, and everyone do well. They have that stigma and a lot of myths. If we clear that, I think that's the theme, close the care gap. So I think
yes.
We need to close that by creating awareness. And the best part, what I like the most is patient education. So probably through such education programs, if we create awareness, the outcome of the treatment will be good for patients. Another case is a pediatric case. The baby was almost 2 years, and now she is almost 14 years.
Oh, wow.
Yeah, so she finished her treatment at the age of 8, I guess. So 2 to 8, 4 years, 4 to 5 years. I mean, after which she was kept on a follow-up. So after one and a half years of aggressive treatment, she was on follow-up. They went to US, and then again they moved back to Hyderabad, and the mother still shares her pictures. So
Awesome.
she had grade 3 and grade 4 mucositis. So that time we didn't know, and that time I was learning nutrition, oncology nutrition.
Okay.
So it was, but whatever it is, I thought no problem, she will come out of it, and we took care. Her mucositis started resolving. So if the patients, they see the outcome,
Right.
they definitely will follow up. They will definitely come back to you. And continue to adhere to the diet what we prescribe.
Correct.
So that way, there are many.
They need that ray of hope. So one
Yes.
hope, if we can give one result, if they can see,
Mhm.
because they 100% or more than 100% they are ready to follow because of the
Yes.
stigma, because of the severity of the disease. Yes, yeah.
Mhm.
That
There's a lot of
I think
fear.
we need to go out of the box.
Yes, 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 yes.
And
Yeah.
one question here, ma'am, like as Dr. Janki was saying, like, the fear or, the kind of thoughts that they carry, what would be your approach to, just bring them out of, such thought process? What, out of your experience, few advice.
You have to be a listener.
Okay.
You have
Very
to be
true.
a listener. Give your ear, lend your ear. Yes.
Very
Listen. Keep listening. They will tell the same thing.
Right.
And they'll go to with the same question. Suppose now I'm sitting in the OPD, that patient comes, right? Now next day my colleague is sitting, the same question. So I tell my colleagues also, listen, keep listening. And once they tell you everything, tell and tell. Okay. That is, tell what you're going to tell what you're telling, and tell what you're going to tell.
Right.
So I
Very
think
nice.
that's what it is. Yeah.
Yeah, if you
Yeah.
don't mind, I just want to just talk a
Yes.
small episode. Of course, exactly what Vasudha has been telling right now. A very close friend of mine is an oncosurgeon in Pune, and they have a small nursing home. And exactly, and this is something about 30 years back, what I'm talking about. If you're talking about 25 years, we hardly had any nutritional this thing and all that. And once I'd gone to her place, and then I realized, she said, Avanti, you must come to my nursing home. So I went. And everybody was asking only about her mother-in-law. So I asked her, what is it? She said, Avanti, nobody likes me. They like only my mother-in-law. Because every day morning she would go more like a counselor. Like Vasudha said, like a counselor, and just listen to them. And they would say, I feel like eating this. She would make it a point to make something like that and go for lunch. And my friend would get upset. Why are you giving them? She said, they feel like eating. How much are they going to eat? 1 spoon, teaspoon. They will not eat more than, let them eat. And then, so everybody would ask about her mother-in-law, but not. And they would pour out all their anxieties in front of her, but not with the doctor.
Yeah.
They wanted an ear, like Vasudha said. I'm just remembering that. They just wanted an ear and just let out all their anxieties.
Yes,
yeah.
absolutely.
True what you said. Absolutely true what you said. Yeah.
And simply because what we tell is the main thing in my clinic, wherever I treat patients, I want to follow up on their weight every week. So most of the radiation patients, I call them every week. I tell, okay, fine, every Friday you're coming here, check your weight on this weighing machine, let me record it, and then you go. So as soon as they would step into the room, they would directly go and stand on this thing, and they would ask, they keep a track. So that is one thing where we should also in follow-up, weight monitoring is very important for patients, because patients, especially high risk and patients who are at high risk for malnutrition and weight loss, especially in upper GI, head and neck cancers, weight monitoring is very important. Yes, of course, even the side effects, we need to monitor the side effects, possible side effects, and do not just blindly counsel the patient. If the patient is on chemotherapy, know what chemotherapy medicines are going, because each medicine has a different side effect. So we need to go through the medical records, see what medication, what treatment is being planned. Do not blindly counsel the patient without knowing what surgery he has undergone, what medicines are going on. So you can counsel accordingly. Yeah, that has helped me.
Great. That's really true.
Yeah, there are many other, and the most which is very close to my heart is the support group program. And there I have learned oncology and nutrition through that program. Because they have so many doubts on nutrition, so many myths about nutrition. They say don't eat brinjal, don't eat gongura, don't take sugar, don't take milk. So I would not know what to answer. So go back, see studies, and then that is how I have learned.
Yeah, everyday studying is important.
Yes, you have
every
to
case
be updated.
Is different.
Every case is different. Yeah. So these are, I think there are many more. I thought these are the best and very, very close to my heart cases, which I thought I should. Even there was an NRI patient whose mother was undergoing treatment. So they also had a lot of difficulty with language. Was one thing. The mother didn't know any other language. So the son used to follow up, and he would travel up and down, and they had availability of their local food was a problem. So we really helped them, and patient did well and went back to his her country. Yeah.
Nice.
Yeah.
So request all audience who are here and people who are watching from Facebook Live, you can post your questions if you have any questions on the chat box or in Facebook. You can post your questions so that when Vasudha is here, she will answer all the questions. So talking about the positive cases, positive experiences, I'm sure when the positive is there, the negative has to be there. So what are your bad experiences with the patients?
Well, I will not say it as a bad experience.
Maybe a learning experience.
Learning, and it will turn to be good on at the end.
Yeah. I would say I would call it as a challenging experience.
Correct.
I would call it as a difficult experience. Yeah. So there is one case which I am again following up on presently. This is a case of breast, where all the line of chemotherapies were done, and it is like now no more treatment. So they've again switched over to, because of the metastasis, again now they have switched to some other medicine. I mean, the third line of medication has started. So this case from the beginning it was very difficult and very challenging. Okay. From the beginning, she had a lot of side effects. She had severe back pain, so mobility was an issue. That is not a side effect, but known case of back pain. She was obese, and she had problems with diarrhea, nausea, severe diarrhea, and we didn't know as what to do. Then things went fine. She continued. They changed the medicines. They found out the root cause. She was not tolerating that particular medication, so they changed the medicine to some other medicine. Other problems started developing. Okay. Every time she would either send me a message or call me and tell, she would just say, okay, I just want to talk to you and I want to cry. Oh. I'd say, okay, no problem. So she would cry and then say, okay, what is it? My end is coming. I said, who told you the end is coming? Did the report tell you? Is there anywhere in the report that you are having cancer? No. And then what is bothering? So for how long will this happen? Is this going to be there for lifelong, this thing? So somehow we counseled and we put her on different type of diets. We used to every once in 15 days we used to send her, actual a day's menu. 15 days menus we sent, and we helped her. Definitely she was doing fine. Now again one fine day she calls and says, anything I eat, it tastes bitter.
Mm.
So I said, so what? No problem. I said, madam, I've lost the taste. I can only taste bitter. Even if water I am drinking, it is tasting bitter. I said, okay, have lemon. Just squeeze one lemon and have in front of me. That is also tasting bitter, she said. So I didn't know what to do. And then I told, okay, fine, you have Karela. Anyways, your mouth is bitter. So start accepting it and start liking the bitter taste. So, but that is a very difficult situation. As what should I tell her? We put her on supplements, we put her on clear liquids, but it was a very difficult case. She did better, but then it was the medicine which was causing that. So they had reduced the medicine dosage, and then after which again they did a PET CT, and then again the line of treatment had to be changed. So now the line of treatment again it changed, and she developed diarrhea and vomitings, non-stop diarrhea, and the patient was on. She lost almost 8 to 10 kgs weight, and so she was on infusions and electrolytes and all those things. So that is a challenging case. So I have a follow-up this week, so I don't know what is in store, but I wish that, and I hope that she's doing fine, because they have again changed the medication. So I told her diarrhea will come down once the medicine effect starts stopping. Yeah,
I feel there will be kind of resentment. They don't want to listen.
Yeah.
They simply don't want. They want to take it off.
Yes.
So whatever they have on their chest,
yes,
you have to listen to that.
Yeah.
Let them bring it up, and then you have to listen.
Or even the thought process will add on to these kind of side effects.
Yes, because she's not a patient from Hyderabad. She's from out of Hyderabad.
Right.
And her daughter, again, she has a son and daughter, son who's not married, and daughter stays in Delhi.
Okay.
So daughter took her to Delhi, and they changed the doctor and all that happened, and then she's back to her hometown, and again she's not well. So she has the feeling that she's dependent, and she's troubling her own people. So here, what is important is that each oncology setup should have a team of allied services, where there is a psycho-oncologist. We take help from our psycho-oncologist, who such kind of patients who don't, who are unable to listen to us or something, because at the most I can just listen. But if a psycho-oncologist, they have different modalities of therapies and counseling sessions which can help. So I think that is very important, to have a psycho-oncologist also, and other allied services as a team to counsel a patient. They are depressed. They are really depressed. So even if they are doing fine, they get those thoughts that, no, I can't eat. How much ever we say, this is just a treatment side effect process which is temporary. It is not going to be there forever. So that is one difficult case which is on hand, actually.
Okay. So we have a question from Samathan. So ma'am, good evening. So what are the common myths that you have encountered with regards to the cancer?
Yeah. Common myth is patients don't take brinjals. Patients don't take milk. Patients don't want to take sugar. And patient, they don't want to take any treatment also sometimes. They say it is unnecessary. If you're treating it will end you up in more of more of complications, trouble, and then most of them don't live, because then they die because of side effects. But nutrition point of view, these are the things. And so many, every second person who's undergone surgery, they don't eat dal, they don't take curd, they don't take rice, because they have stitches. So they have the myth. Still the myth is there that that will get infected and the pus formation will be there. Yes. Yeah.
Okay.
So these are the common myths which we experience.
Right. Chandrika is saying Vasudha ma'am was so helpful every minute. I was learning. Chandrika. Okay.
Yes, Chandrika. Chandrika is also here.
Yeah.
Yeah.
Good evening, ma'am.
Yes, Chandrika.
Good evening, ma'am. Hi, ma'am.
Good evening, Chandrika.
Ma'am.
Yeah, Chandrika was my ex-colleague now.
Okay.
Wow.
Okay.
So,
she's working in Basavatarkam now. Chandrika.
She was initially when I started my career there, and now she is very much in Katnu.
Okay.
Shantira Medical College, ma'am, in Nandyal.
Okay.
Yeah.
Nice. Samatha, you have any question? You have raised your hand.
Yes, ma'am.
Yeah, go ahead.
Good evening, all three of you and others. Vasudha ma'am, there's one thing I often read or listened to on the net itself, not from any textbook or so, that having sugar would reduce the immunity. The white sugar. So that is how the cancer patients are refrained from taking sugar intake. So how far is it true, ma'am? Not maybe a direct cause of cancer or anything, aggravating the cancerous state, but the immunity of that person who is undergoing the treatment, where the immunity is already compromised to some extent. So what is your take on this note, ma'am?
Yeah, I have never stopped my patients to stop using sugar. There are evidences, there are papers where they say that taking sugar will increase the growth of cancer cells. But see, sugar for any person, if it is being taken in more than the recommended allowance, that is harmful. And being a refined product, it is definitely not good. But it lowering the immunity, I don't think so. It doesn't, because there are patients are immunocompromised, but taking sugar will not definitely will not lower the immunity. Yeah, but what we tell our patients is you have to limit it to the recommended allowances, not to take more than 3 to 4 teaspoons. So keep a watch. But if a patient is not eating food from morning to night and wishes to have a bowl of ice cream or a custard or a pudding, I say go have 3 times some kheer paisam. Don't stop, eat.
Right.
So you have to go.
Thank you so much, ma'am. So, but
Yes.
this is like proven thing, ma'am, that increasing the cancerous cells production.
It is not just one paper or so. It is said, but then we don't know which type of population and what was the amount. How much? The amount of sugar consumption will lead to increase in cells was never mentioned. So yeah.
But then
So
suppose
much,
if we don't eat sugar, or if you don't take protein, our own muscle will break down and provide, isn't it, for the growing calcium?
Yes.
So in the process, the patient may lose weight if they don't take enough nutrition.
Yes. It has to be a balanced diet. Yeah. But again, we can't force a patient who's having so many side effects. We can't say, no, you have to have 2000 calories. You have to work out 2000 calories. You have to see how you can make the feed dense. giving, all ingredients. Instead of patient having just a cup of milk, ask the patient to blend it with some dry fruit powder and a fruit, make nice smoothie and give it. Right. So even if the patient is having 100 ml, make sure that it is dense in calories and proteins.
Right.
Ma'am, one more question, ma'am.
Yeah.
Ma'am, apart from having a balanced diet, nutritious diet, what general recommendation do you give to a cancerous patient post the entire treatment or recovery? Because I have seen, few people, they're like back to their routine and again back to their own old habits of, having those unbalanced and that improper timing and all. So what is that one general thing we have to suggest to these patients now?
Yeah, Samatha, can you introduce yourself?
She's a doctor.
Ma'am, I'm actually a general dentist, ma'am. Currently, I'm not practicing. So in the meantime, I thought I'll, pursue a course in nutrition. So I'm doing this PG diploma course from Dr. D.Y. Patil University, Mumbai.
All right. Yeah.
Just started off.
Yeah. Thank you. Yeah. So the piece of advice to patients who are undergoing treatment and who have finished treatment is to have a balanced diet and to have a nutritious diet. We all know what is a nutritious diet, to cut away from, cancer risk foods, the risk food groups, like all junk foods, high calorie foods, like fatty foods, processed food. These things we ask them to avoid post treatment, identifying whether what are their risks to maintain a body weight, healthy body weight, do regular exercise, and involve in some stress management techniques like yoga or meditation, and have plenty of liquid, especially during the treatment, because they are dehydrated. They need to be well hydrated. So plenty of liquids, a high protein diet is what is recommended. Because post-treatment, if the treatment gets over, the patient is in the bracket period of recovery, so say for about 1 year, whatever the treatment has been done. After which, again, total 5 years is what they have to take care, because relapse can happen within 5 years.
5 years.
So my treatment is over, now I have to be normal. That should not be the spirit. They have to keep a watch, go for the regular checkups, continue all healthy lifestyle habits.
Okay, ma'am. Thank you so much, ma'am.
Yeah, thank you.
So, ma'am, with your this varied experience, can you please can you please pinpoint what are the lifestyle habits or lifestyle habits that cause cancer for our general audience?
Yeah.
Can you please help them to understand?
One common thing which I have experienced in the patients whom I have seen is weight loss and this yo-yo dieting. I call it as yo-yo dieting because for first 3 months or 6 months, they follow one particular diet and they say, no. When someone says, no, you go to follow that diet, without going to the right person, without reaching out to the qualified nutritionist or a dietitian, they just browse on the net, or just they see someone practicing and they have lost 10 kgs weight, I will also follow. Blindly they follow. So such patients, they end up, such people, they end up getting diagnosed as with cancer of something, leukemia, or mostly because their immunity will come down if they are particularly following and losing weight, fast. They look for fast results.
Right.
That is one thing. And most of the there was one paper presented and there was a study also done, I don't recall, but taking red meat, the other day also I just happened to mention about this in the previous talk. 30 years if you take red meat, that poses a risk. The risk for colon cancer is there. So it is not that I am 50, 40, I'm fine, I'm eating, I don't have anything. So it takes time also. It is not that you eat today a lot of sweets and tomorrow you get diagnosed with cancer. It's not like that. Throughout your lifetime, you have to follow a few things, that stay away from processed food, stay away from red meat, especially the proven ones. Where the high salt intake, the stored pickles, and the dried meat, sun-dried and salted meat. These all the risk risk increases if we are continuously using this. I'm not saying that we should stop and we should not enjoy our life. We should have, but that should not become our staple, and that should not be our diet on daily basis. We should go out, we should eat outside food, but we should know how much to eat, when to eat, how frequent to eat.
Right.
Yeah, I think that is what I have a say on that.
Great.
Yeah, can I ask one doubt to
Yes.
Mayuri?
Yes,
ma'am.
yes, Dr.
Just one small doubt I have. Post surgery or post chemotherapy, invariably patients have, as we were mentioning, that that lingering metallic taste, bitter taste, and all that. And how much ever you try, it doesn't go. But you must be suggesting some tips, no, that you can suck onto something.
Yes.
It will give you some relief, like
Yes,
you said,
yes.
lime.
Yeah.
What other things do you generally tell as a general?
I asked them to have the popsicles. I told you that there was a case I am dealing with now, who has the saliva collecting. She can't swallow because there is no entry to the stomach. So till they again do a reconstruction surgery, she cannot eat anything or even swallow her saliva. So she says that, he says that, the mouth is too dry. What should I do? So I told her to, told him to just sprinkle some lemon on ice, crushed ice, keep it in your mouth and then throw it out. Okay. So that is one thing. And lemon, they can just lick onto some lemon and incorporate savory items whenever there is dryness of mouth or there are taste alterations. And avoid odorous food, like, if there is a metallic taste, avoid eating in metal plates. You can have some glassware or crockery. Yeah. And if they are having mucositis is a very difficult thing which a lot of bone marrow transplant patients experience. So what in case of mucositis, one thing we ask them is to avoid taking milk, but take more of, because lactose, again, that interferes with the lining, whether it is oral cavity or it is intestines, whatever it is. So milk we ask them to avoid and replace it with curd or buttermilk. And then soft food, ice creams, smoothies, milkshakes, and straw feeding, so that directly the food goes inside rather than it is being there. Use less of mouth activity. So directly which they can gulp. So they can have nice soft custard, or even food, dal, rice, if they can have
very
plain dal, khichdi, or something which is blenderized, which is smooth. And then to make it more, because see, if they are using this much rice and they blend it, it becomes this much. That is not sufficient. So they can add separately in the eating bowl, in the bowl in which the patient is eating, we ask them to season it with a teaspoon of oil or ghee, half teaspoon of ghee or a teaspoon of oil, so that some calories will go.
Okay.
Yeah.
Thank you.
Yeah.
So you similarly have like how you have given us the lifestyle tips. Can you give us some best practices to prevent cancer?
Yeah.
You have already given, but
yes.
Stay
happy. And now a lot of science and technology, it's improving. So maybe there are a few cancers which now we can identify that it is because of heredity, the genetics involved. So if there is a family history and if there is any symptom which you feel, go for genetic counseling. So that early detection, definitely it can be cured. So to prevent cancer, yes, if there is a family history, definitely you need to go for regular screening. There are different screenings. Go for a regular checkup, and if any symptom of cancer or something which is nagging for a long time, don't neglect, go to the doctor. That is one thing. And to prevent, healthy lifestyle, no stress management is very much your personality. Don't be too aggressive, but don't be too passive also. Be patient, and stay happy. Happiness is one thing, and eating a balanced diet and avoiding all unhealthy food and unhealthy practice, healthy lifestyle. We know nowadays each one of us knows what is healthy lifestyle. So
Thanks
I
to
think,
COVID.
yeah. So that is one thing which we go for regular checkups, and that's how we can prevent, I guess. Yeah.
Probably these are the things that we can think about as a screening points. Like, if you have a health, our own health nagging problems or family history, I think it is better we do. And the type of lifestyle we lead, that's also very important.
Yeah. And for cervical cancer, now there is a vaccine. So we all have passed that age, but at least, the young daughters and all, they go for counseling, see if, whether your daughter or anyone, any of them are eligible, that they can take the vaccine, get them vaccinated, because vaccines have come to prevent cervical cancer.
Yeah. But yes, what you were saying, this routine checkup still is something. I mean, I'm not even about cancer. I routinely ask, because I feel it's my job to, create that awareness. I ask my students, how many of your parents go for their annual checkup? Simple, blood sugar, lipid profile, something. All of them say, no, ma'am. I mean, even now people are so apprehensive, just going for their annual checkup, nothing in detail. Women, as the other day, Vasudha had come as a guest speaker for us. And then we were, afterwards, I was just reading, even mammograph or your pap smear and all that. Nobody's asking you to do annually. I said, here, blood glucose and lipid profile itself, the girls give a feedback. No, we don't do that.
There is a stigma. There is a stigma. There is a stigma that if they go to the doctor, something will come up. But they have to take it as if something, at least you know what is happening, and you can get yourself, because now with cancer it's curable, because so many patients, treatment is difficult, and now in treatment also there is supportive management. So now if we know this particular chemo medicine is going to give you this side effect, we already put them on those kind of medication, supportive medication. So side effects, the day one, what I have seen patients suffering to now, it's definitely the side effects have come down. Patients really do well.
Yeah, they're really doing well. This advanced medication and the supportive therapy is quite good. Understanding is
it
more.
Is just that, for small time there is a lot of discomfort to the patient, but after which they really do well.
Correct.
And the team is preparing the patient very well also to what it was before. It was like, they only used to reveal that it is cancer to their attendants and all. The patient might not know sometimes, like how we see in movies and all. But now it is not like that.
Yes, there's a proper rehab. Yes,
patient knows, patient is well prepared for that, and the acceptance is more. And of course, outcome is very good. In fact, they're progressing well in that way.
Very true. Yes. So as we are nearing the time, so I have like this one question, which is very important, I feel, as a nutritionist. Can you please tell us something about the GI related cancer, and a piece of advice for the budding nutritionist, regarding to the GI cancer?
Yes, GI cancers per se, we can look at into two, that is lower GI and upper GI. Lower GI, yes, it is again small intestines and large intestines, ascending colon, transverse, descending rectum. Upper GI is all esophagus, head and neck. So upper GI cancers, there is a risk. Upper GI cases, patients are at a higher risk for malnutrition because this is the way where we eat food.
Right.
So we should try to prevent that. The causes again is smoking, alcohol, high fat diet, and eating hot food, very hot food, salted food, spicy food, and eating very fast. These things are a few of the causes which I have experienced when we talk to patients. These are the things. And the treatment again involves in upper GI, it involves chemotherapy, radiation, and surgery, or any one of the modalities of the treatment. Yes, treating such kind of patients is definitely a big challenge. Lower GI incidence of malnutrition is not there, so not much. But if there is a colostomy, if there is an ileostomy, we have to take special care for counseling the patients. The diet remains the same thing as what we have discussed all through. I think that's, if anyone has any more questions, I'd be glad to answer that.
Yes.
Any questions from Facebook?
No, doctor, as of now, no questions from Facebook. I'm checking. So audience, Vasudha ma'am is here. So any questions with regards to the cancer related, please post your questions. We are here, and ma'am is here to solve, give you the advice. Yes, doctor. There is like one other question, like, is there any one particular food that cause cancer? General audience generally ask this.
There is not one particular food which will cause cancer, yes, but the unhealthy food, the smoked food,
right,
combination of smoking and alcohol definitely will put us in trouble if we have that.
Right.
Too much of high salt diet, and the salted pickles and the dried meat, these all definitely have carcinogens.
Right.
Does using microwave oven, for cooking and reheating on a long, for years, does it has any role in causing cancer, and also, ma'am, barbecuing, as you said, does that also cause?
Smoked meat, smoked food with the juices, yes, if that is again taken on a regular basis, that definitely has carcinogens on charcoal, especially on charcoal, grilling and all those things. And the other question, I'm sorry, what was the first question?
Microwave oven, ma'am.
Microwave oven, yes, but preferably we need to use the material what we use to heat is glass rather than the plastic. But again, the permitted microwave bowls can be used.
Safe bowls, microwave safe bowls. Because I have seen people using the same plastic. What you get those balls, ma'am, with the set as a complimentary thing, the complete thing. They're still using. In my own family, you see the base of the ball to be like tiny holes and dents, like.
You need to keep changing it. How much you use it is, if you're using it every day, then as soon as the color changes, or you yourself can see that it turns black and it leaves the color of the food particles, then the time is to replace that. But the best is to use the glassware.
Yes.
Yes, ma'am.
Yes,
Because I
what,
have
what
seen people
correct right
buying this
now, that is what
plastic.
they're talking about. Even when we say it is food safe, but now they're advising not to use
Yes.
plastics and
Yeah,
microwaves.
yeah,
Even though
because
they said for it, yeah.
the high
Ma'am,
temperature with plastic, again, there is a risk of carcinogen, the food getting carcinogenic.
no, ma'am, you literally can see that it's time you throw it away. You should discard, but still, people are just using the same
Yeah,
thing.
you should not leave
You
it till
can do the job.
till it breaks, till it breaks.
You can throw
So
it away for
Yes,
them, no
ma'am.
problem.
We are very conservative that way.
No, ma'am, they're not thinking like the preventive kind. Chalo aane do, uske baad mein we'll see.
Thinking.
Whatever has to happen, only then we will, panic, will worry. Then we will think of other things. But prevention type, nobody is bothered to. So I stopped telling a few people, ma'am.
So the menu for the
Thank you.
weekend party is barbecue, like carcinogens, carcinogens on the menu, like smoking, drinking, and barbecue. Okay, so we almost come to an end. We passed 1 hour now. So this last one thing, just interesting fact which I noticed is, how do you resonate your birthday being on 4th February, World Cancer
So
Day?
day. Yes, even I was having this
it must be a coincidence
coincidence.
or
Just like
what, because that was
Ma'am, that's a
again.
blessed gift to Vasudha ma'am.
very true. Just like Dr. Janaki Jan 10th.
Yes,
Yeah.
dietetics.
Dietetics Day.
Yeah. Yeah, I feel special on my birthday, and a couple of past 1 decade or more than that, I'm the most busiest person on that day. So
Okay.
my birthday celebrations will be towards the end of the day, but somehow they, my colleagues have squeezed in time, to celebrate my birthday as well. Yeah,
Correct.
so yeah, I feel happy about that.
Great, nice. Then we'll
Yeah.
say goodbye today for today.
Yes. Yes, done.
Thank you
Vasudha,
so
once
much.
again.
Yeah, thank you, Dr. Yeah,
Thank you.
thanks for this
Thank you, ma'am.
opportunity. Yeah, thank you. Bye.
It
So
was very
Thank you,
nice.
Janki.
It was
Thank
very
you,
nice.
Mayuri. It was good.
it was great interacting with you, ma'am.
Nice.
So
Yeah.
Thank you.
yeah, thanks for being here on Tea Talks and sharing all your experiences. And we have gained, I hope all audience have gained some knowledge with regards to the cancer. And thanks for being here on Tea Talks.
Yeah, and I congratulate Tea Talks for having every week there is a different topic, and definitely I congratulate, and my best wishes that you do
Thank you so much, ma'am.
coming weeks. Yeah,
Thank you.
Thank you.
Thank you. But without all your help, all the dietitians who are there been on detox, this would not continue this way. And we are very happy that some of the other dietitian nutritionists coming up and supporting this cause to gather.
In fact, sometimes I don't get time to attend it live like I got it today. But then that's what I was telling Mayuri. I go to the Facebook, and whenever I have time, then I listen to the recorded version.
Right. Yes, we do all talks. We do get minimum at least 800 people minimum looking at the video after it is done. They may not have time at the particular time, right, between 4 and 5, but later they can always see this. But the basic idea is that we need to, like experts like you come and share your knowledge and thoughts and experiences. It will create a knowledge bank. So anybody who wants any clarification, any doubt, they can go back to that particular video and then check for the doubts. It will be clear. This is the basic idea for starting Tea Talks.
Yes.
Janki ma'am, I should tell you one thing. I put a reminder, I just 15 minutes before the phone buzzes, then a tea talks. Even if I forget, my daughter, she's it is Tuesday, I tell you. So Tuesday, if you say, she'll say tea talks. That goes, hand in hand.
Oh, good.
Thank you so
Awesome.
much, ma'am. Nice.
So yeah, thank you all for attending today's session. See you all next Tuesday, same time, same place. Bye for today. Bye-bye.
Bye. Thank you. Bye.
Bye. Bye.